A woman's body naturally produces vaginal discharge to help maintain vaginal health. While it's usually nothing to worry about, changes in its appearance or smell can sometimes indicate a problem. So, how can you tell if your vaginal discharge is normal? Let's explore the characteristics of normal and abnormal discharge. Typically, normal discharge is white or clear and may have a mild odor. Its consistency can range from sticky to watery. White discharge often appears at the beginning or end of your menstrual cycle. It is usually thick and sticky and usually has no strong odor. Clear and watery discharge commonly occurs when you are sexually aroused or pregnant. This type of discharge is often a normal response to hormonal changes. Clear and stretchy discharge indicates that you are ovulating. This type of discharge, which resembles raw egg whites, typically occurs around the middle of your menstrual cycle and helps facilitate sperm movement through the cervix. Brown or bloody discharge can happen during or right after your menstrual cycle. This type of discharge is often the result of leftover blood from your period that has taken longer to leave the body, and it is usually nothing to be worried about. Yellow discharge may not indicate a health problem, as it can turn this color when exposed to air. However, darker yellow or green discharge, especially if it is thick or has an unpleasant smell, is a sign that you should seek medical care. The change in the smell, color, or texture of vaginal discharge can be caused by alterations in the vagina's bacterial balance. When the number of harmful bacteria increases, vaginal infections are more likely to happen. That's when the vaginal discharge would not appear normal. Now, let's take a look at some causes of infection and what they look like. Bacterial vaginosis. This causes increased vaginal discharge with a strong, fishy odor. The discharge may be thin, gray, and watery. It can increase the risk of contracting sexually transmitted infections. Trichomoniasis. This is caused by a parasite and usually spread through sexual contact or sharing towels. Most have no symptoms, but it can cause green or yellow discharge with an unpleasant odor, pain, itching, and inflammation during sex or urination. Yeast infection. This results in thick white discharge similar to cottage cheese, usually odorless. Symptoms include itching, burning, or irritation around the vagina. Yeast infections are common and can be treated with over-the-counter antifungal medications, but recurring infections may need medical attention. Gonorrhea and chlamydia. These sexually transmitted infections cause abnormal discharge from cervical infection. The discharge can be yellow or green and may have a strong, unpleasant odor. It may also be thicker or more mucus-like than normal. Symptoms include stomach pain, pain while urinating, and bleeding after sex. Prompt medical treatment is required to avoid complications and prevent spreading. Vaginal discharge is natural and can't be prevented. However, steps can be taken to reduce the chances of infection. Gently wash your vagina with water and avoid using scented products and douches. Thoroughly dry the area and wear breathable cotton underwear. Maintaining good hygiene and following safe sexual practices can greatly reduce the risk of infections. Thanks for watching. We hope you found this information helpful. Don't forget to like, share, and subscribe for more health tips. If you have any questions, leave a comment below or talk to your doctor. Stay healthy.